To be clear, we do not yet have a confirmed case of the novel coronavirus here in Iowa. We have identified 2 individuals who are being evaluated for that illness, but we have not yet identified a confirmed case.
You heard it right there. No cases yet. Good evening, everyone. I'm Ron Steele.
And I'm Abby Turpin. Thank you for joining us.
Our top story here tonight, live at 10 o'clock. The Iowa Department of Public Health is investigating, though, a couple of possible cases of the coronavirus.
Health officials are awaiting the test results for 2 Iowans who recently returned from China, where the virus originated.
KWWL Iowa City Coralville area reporter Travis Breeze is live for us right now after talking with a specialist about trying to spot some of the symptoms during the ongoing flu season.
Ron and Abby, an infectious diseases specialist told me while the symptoms for the flu and the novel coronavirus are very similar, you only need to be worried about the latter if you or have been to China or have interacted with someone who has. Experts also say that the risk to Iowans remains low at this point, but that it may be time to start getting prepared.
Anytime there's a novel virus, there's a heightened sense of awareness.
Health officials across the state are closely monitoring possible cases of the novel coronavirus in Iowa. But many say it shouldn't be a surprise.
We need to realize that we live in an interconnected world, a globalized world. We have populations from every country in the world living here in Iowa.
Dr. Jorge Salinas says people seeing symptoms for a respiratory illness should behave like normal, practicing good hygiene and recovering like they would from a cold or flu.
But it's much more likely to be due to those viruses than the novel coronavirus.
Dr. Salinas says the University of Iowa Hospitals and Clinics is asking incoming patients travel questions, much like the U.S. is protecting its borders.
Have you traveled in the last 14 days? Do you have any symptoms such as fever or cough?
While the mortality rate for the virus remains only around 2%, experts remind people to stay on high alert.
Folks need to be concerned, they need to be aware, they need to start thinking about preparations.
Now, the Ebola virus spread in a very different way a few years ago, but health officials do say that quarantines are being set up similarly to that case. You can find any updates that the Iowa Department of Public Health puts out on our website, KWWL.com. Reporting live in Iowa City, Travis Breeze, News 7, KWWL.
Travis, thank you very much. The World Health Organization says the virus has killed 425 people in China and 1 person in the Philippines.
Now, closer to home, the Wisconsin Department of Public Health is confirming tonight that state's first case of coronavirus. That's in Wisconsin. The person, though, has not been hospitalized and was said only has mild symptoms. Now, the Centers for Disease Control is releasing more information as the virus continues to spread. So far, CDC says it has tested 293 people from 36 different states. 11 did test positive, but 206 were negative, and the rest results are pending.
Meanwhile, dozens of Americans will be quarantined in eastern Nebraska after arriving from the epicenter of the coronavirus. 70 Americans will be sequestered at Camp Ashland, that is just outside of Omaha. A team from the Centers for Disease Control will check them for signs of the coronavirus. You
heard from the University of Iowa Hospitals and Clinics tonight. You might remember we recently did another story on how the UHIC is preparing if someone does come to the hospital in Iowa City with the coronavirus. That story is still available for you right now to read on our website on KWWL.com.